Good afternoon, everyone. This is our 12th briefing for Protector Province, BC on this Thursday, 23rd of 2022. The briefing title is Name It to Tame It. COVID is Airborne. For those of you who don't know, Protector Province, BC is a grassroots initiative involving physicians, nurses, health scientists, health policy specialists, researchers, community advocate, parents, and teachers. And we're working together to help the people of British Columbia stay informed using an evidence-based approach. And we also pressure the government to apply science to its measures and its policy. Our ultimate goal, like everybody else, is to end the pandemic. So we will begin today by first respectfully acknowledging that we're broadcasting from the traditional, ancestral, and unceded territory of the Coast Salish peoples. Specifically, our team is situated on the Musqueam, Squamish, and Tsleil-Waututh nations. We're grateful to the Indigenous peoples who have cared for these lands since time immemorial. As settlers, we commit to do our utmost to uphold the Truth and Reconciliation Commission and work towards the 94 calls to action. In addition, today, we'd be remiss not to mention that our thoughts and prayers are with the people of Ukraine on this dark day in history. So today, I will be your host. My name is Dr. Lynn Filiatro. I'm a retired emergency physician who's practiced her entire career in British Columbia, and I am a proud member of Protector Province, BC. Next slide. Our topic that we'll cover today is the main mode of COVID-19's transmission, meaning aerosol. We will not be spending all of our time on all of the science that's been accumulated. The two professors who are joining us have many presentations available that are an hour long on this very topic. What we'll be focusing on today is why the WHO and BC Public Health keeps getting it wrong when it comes to the mode of transmission. Then we'll delve into why does it matter, why it's not just semantics, how the virus spread, and why it's so important to get it right, because next steps, you know what you can do to prevent the spread. We're honored today to be joined by two world-renowned professors who have basically dedicated the last year to debunking the myths when it comes to the spread of COVID. So first, there's joining us will be Professor Kimberly Prather, who is who is the director of the NSF Center for Aerosol Impacts on Chemistry of the Environment. She's a distinguished professor and chair in atmospheric chemistry at Scripps Institution of Oceanography, and she is from the University of California in San Diego. Next is Professor Jose Luis Jimenez, who is also a distinguished professor of chemistry, a fellow of Cooperative Institute for Research in Environmental Sciences, and comes to us from the University of Colorado at Boulder. So first of all, thank you for joining us today. And I've read all your titles, but I thought I'd start off with an easy question. What do you tell people that you meet for the first time when they ask you, what do you do? So Professor Prather, we'll start with you.
So it depends on the day, but I often just say when I say I study aerosols is kind of, that's my expertise for over 30 years. It's interesting because now people actually know what aerosols are because of this pandemic. They think about things. They used to think that I studied stuff that came out of a spray can. So yeah, but I basically just kind of, and then I go on to explain, how my day job has been understanding how aerosols move around outdoors and how they affect our climate. And so the being pulled into SARS-2 has been a wild adventure, a little bit of a deviation, but it still involves aerosols, as we'll talk about today.
All right. And then Professor Jimenez, what's your response to that question?
It's similar to Professor Prather. So I've been working on the air and aerosols and different aspects of it for 28 years, doing everything from building instruments to measure them, to flying them in airplanes over the North Pole, or to measuring them indoors, and basically using mathematical methods. So really, so all kind of research that goes around aerosols in every possible way we can think about them. So, and then, so naturally I came into the pandemic and to my surprise realized that there were things I could help with.
Well, we're certainly thankful that you stepped up to help us understand how SARS-CoV-2 is spread. So I'll pass the baton to you, Professor Jimenez, to take us through the next couple slides.
Thank you. So what we were going to summarize very briefly is what is the main mode of COVID transmission. At the beginning of the pandemic, we were told it was these large droplets, these projectiles. You're talking to someone and they sneeze, they cough, and these projectiles hit you in the eyes, in the nostrils, or in the mouth, or you touch a surface and that has a virus, and then you touch the inside of your eyes, the inside of your nose, or the inside of your mouth, and that's how you will get infected. Now we know this is not the case, or this is a minor pathway, right? The science is clear. And if I could have the next slide, maybe can we make the slide bigger and me smaller? I'm not so important. Yeah, okay. So there were a series of things we call myths that were kind of the traditional understanding, that aerosols were smaller, only smaller than 5 microns, and everything larger only travel 1 or 2 meters. And if there was transmission in close proximity, this was a proof of droplets. And a number of others. And now we know that all of this is false, and really the science is different, is not necessarily more complex, but it had been misunderstood. And if I can have the next slide, it's probably going to become clearer. What WHO and public health in many places, including British Columbia, has said during much of the pandemic, and I think they are still saying in BC, although they are now one of the outliers, is that if you have transmission in close proximity, when two people are talking, the two people on the left, that's because of the droplets. The transmission there happens because of these projectiles that fall to the ground quickly. But then we know, and I don't think there is anyone who disputes it now, that we also have transmission in situations like for the person in the right, a person who's not close to anyone, but is still in a choir, in a meat packing plant, or in the spin class like in Toronto, or so many other super spreading events, and people get infected by breathing the air in the room. Now, there is a logical inconsistency here. If the stuff on the left is droplets, is projectiles, how do the aerosols make it to the person who's sharing the room if they are not in the left, right? So we can have the next slide. We see that this is the actual situation, right? For the aerosols to be diluted, and still be effective for a person that's in a choir or in a meatpacking plant or in a spin class, they need to be very, very concentrated when they leave a person, okay? So the right analogy for transmission is cigarette smoke. It's not perfect, but it's a very good analogy. It's very concentrated when it leaves the person. That's why in close proximity, you are very likely to be infected, not because there are projectiles that fall to the ground, but because the exhale there is very concentrated. This thing of the things falling to the ground is a confusion in physics. For 100 years, the medical profession was confusing gravity with dilution. Dilution is really what makes infection decrease as you increase distance, as you go away from close proximity, and they confuse that with gravity. Okay, But now, once you have this picture, you understand, you can explain all the patterns of the pandemic. You get a lot of infection in close proximity, but with enough time, you can get infection when you share the room. You can get some less common cases of infection even when you are not in the same room. And if you go outdoors, because the air rises and is no longer trapped by a box, then you have a much higher chance of infection. We can go to the next one. So basically, this is now a quick summary of what we think are the facts. The aerosols are much more numerous and much bigger than we thought. And an aerosol of 5 microns is not falling to the ground. It can travel hundreds of meters. And when we have transmission in close proximity, what still in BC, they say, well, that's droplet transmission. That's incorrect. That is mostly airborne transmission, meaning you are inhaling the virus in close proximity. But if you don't inhale it in close proximity, that virus is still going to travel the room and can be inhaled by someone else. And also, I mean, there was still, from the beginning, this recognition that aerosol generating procedures were something that was of concern. Now we know that actually the medical procedures are not of so much concern. What's of concern is talking and singing and yelling, shouting. These are real aerosol generating procedures, and they are very important. Thank you. I think that's all I had to say.
Okay, next slide, please. So now we're going to be talking with Dr. Prather why it's so important to get it right when it comes to mode of transmission. And I'll pass the baton over.
Okay, thank you. So I think one of my most repeated mantras of this pandemic has been, that basically we have to be very clear that the major mode of transmission is airborne. And why is that so important? It's because if we in a nutshell, if we can acknowledge it's airborne, once we acknowledge it's airborne, then it becomes very, very fixable. It's a very fixable problem. A lot of people have been, kind of like that word could scare people, but people really, truly need to understand so that they can know also how to protect themselves. So next slide, please. So, one of the big issues is Dr. Jimenez talked about is that, if once you sort of understand how it spreads, then you can also figure out, how to avoid it and how to protect yourself, as I say. So places where it really builds up are poorly ventilated indoor spaces, as shown in this wonderful graphic. So, we have to just think about, anytime you go into spaces where people are present and talking, yelling, and not wearing masks, those are the places where you have a much greater chance of being exposed. One way this virus has sort of snuck its way around the globe is that many people, basically don't even have symptoms when they're most infectious. And so that can be for a 2 or 3 day period where, people take temperatures. That's kind of not really going to tell you anything a lot of times. They're not coughing, they're not sneezing, they're simply talking. And just in talking, they release these aerosols, which behave in these closed, poorly ventilated spaces, very much like being in the room with a cigarette smoker, where it can just build up over time and everyone in the room shares that same air. So how do we protect against it? If you can go to the next slide, please. So, as I say, it's just so important to get the mode right. Otherwise, as we saw at the beginning of the pandemic, and some places still are doing this, you see lots of hand sanitizer. You see lots of people talking about washing their hands. That's not going to protect you against inhaling these airborne infectious aerosols. And so, I really am a big, big believer that, there's been some debate in the public health community. There's been hesitancy to say clearly that it is airborne. It's every bit as airborne as measles. I mean, one of the bar for calling it airborne has just keeps going higher and higher. But one of the big things was, how do we know you can detect it in the air, but is it still infectious? Well, how do you think people are getting infected? But also it's been cultured from air. Measles hasn't even been cultured from air. So this is, it is, as I say, every bit is airborne. And as time has gone on and we've gone to Omicron, we've seen that it becomes, it's becoming even more obvious how airborne it is. It's always been airborne, but it's just, there's more now obvious. It appears there's even more being sort of in the air. So, adding ventilation, filtration is key. Wearing a good fitting mask. We've bumped up to, KF94s or KN95s, or, even respirators, N95s. The simple surgical masks without a brace, as is shown in this picture, they have leaks, and aerosols will just go right through those leaks. And so wearing the right mask is important. Keeping a distance indoors, as was shown, but it's not enough, but it's better than being up close to someone. And as I mentioned, avoiding crowded indoor locations. So I just want to touch on the filtration idea a little bit. Ventilation and filtration, you have all these different layers of protection. Ventilation, the simplest thing you can do is just open the window, or as is shown here from 1918, you can go outside. And they knew that back then. They were pushing ventilation over 100 years ago. So it's been perplexing to many of us why we are so confused and have made it so hard. In terms of filtration, there's you can buy HEPA filters, just plain filtration. No plasmas, no, snake oil, as we refer to it. You just need a plain basic filter to pull the pathogen out of the air. And one of the really neat ways that people have been really taking it on themselves, because more people can afford it, I should say, are these boxes called Corsi Rosenthal boxes, which I have one shown here that's not a box, it's just one filter. I should have had a picture of it. But basically it's 4 filters, like you put in your HVAC system in your house, 4 filters, duct tape, and then a box fan on top. And believe it or not, these can process the air, filter the air faster than most HEPAs, and they cost, some of them, a tenth as much. You can build one for about somewhere between 70, depends on where you live, somewhere between $70 and $100. And they are just magical. I have to say, my appreciation for them has grown over time. Basically I've had to advise a lot of people who one family member has gotten infected and been sick. So they've tried to isolate in a home with a lot of other people. That used to just be guaranteed spread through all the family. Now I advise them to build 1 or 2 of these boxes, and they put them in the room or in their house. And I don't know of a case of spread that has happened with that being the case. So it's a simple concept, and it's had some of this pushback a bit, which is shocking. It's not hard to understand that if you remove the virus from the air into a filter instead of your lungs, then it's less chance of getting infected. It's not there to breathe it, right? So they're really something else, and we'll put the links up later so people can look at how they can build them for themselves. These are used in businesses, they're used in schools. They really are catching on. 3M, in fact, today just came out with a big article about them, endorsing them today. So it's exciting to see the people just deciding they're not going to wait around for public health to tell them what to do. They know what to do, and they're protecting themselves. So I think that was the end of my slides. Is that?
Okay. Actually, before we move on to the next part, Dr. Prather, do you want to share the consultation work that you did with the schools in San Diego?
Yes, thank you for reminding me of that. Yeah, so I have I've been an expert advisor for San Diego Unified School District, and we were able to help them reopen safely and stay open. And during Delta, that's when we were really getting worried, because it seemed like it was spreading, pretty quick, and most schools were opening and then closing pretty quickly. But what we did that was different, or what they did that was different, is they basically address the air more than surfaces. They still wipe down surfaces, but you only have so much time, so they put more time into like filtering the air. So that every room has air filters. Kids are now given higher quality masks if they come to school without the right mask. And Delta was a big success story, I will say. Omicron has been more challenging. At Delta, we just didn't have we completely knocked back major outbreaks. Kids came to school sick, but they didn't spread it. We didn't have any major outbreaks. But in Omicron, there have been more. It's partly because it's more infectious, but I also think it's the fatigue. Teachers
Mhm.
sometimes were just turning off the filters. They just, weren't, everybody's tired. And so I think that also played a role. But overall, the number of outbreaks, the school has remained open, the schools, I should say. And it's been, again, it proves that it's possible, to get kids back, but it's, you have to be focusing on, the way it spreads, which is through the air to get it to be safe for everybody.
Absolutely. So that brings us to the next section. Maybe we can bring the next slide. So we've made the case that COVID is spread through aerosol transmission, just like cigarette smoke, why it matters so that you can have the right prevention measures in place. And now that we know that, what can we do about it? So we wanted to bring a case study. So I'll take the next slide. Unfortunately, the owner couldn't be with us today, but I spent several hours talking with David Puppy Johnston, who's the owner of the Blue Grotto Bar in Kamloops, where they also put on live show. And if you remember, next slide, they had an outbreak during the Delta wave back in mid-October. They were following all public health protective measures, but you recall these measures are based on droplets and not aerosol. So what they had in place at the time was the vaccine passport was required. There was a mandate for holding events at half capacity. And if you were walking in the bar, you had to have your mask in place. But if you were sitting, you could take your mask off to drink, for example. And all the tables were distance 2 meters apart. And there were also the choke points were also controlled to limit the number of people at any one spot in the bar. So next slide. So on October 14th, they held a live event. It was a punk rock music. There were 3 bands, a total of 12 musicians. The playing time was about 40 minutes to 60 minutes per band. And in attendance were 51 patrons. There were 6 staff, as well as the bar owner. Of note and of importance here is that 2 out of the 3 bands had just come back from touring in Alberta. They'd been in Calgary, Edmonton, Red Deer, and Banff before they played at the Blue Grotto on October 14th. So we will now show a video just to give you a little bit of a sense of what the bar looks like. And I ask you to pay attention to also where the plexiglass is and the layout with respect to where the band would have been singing and where the dance floor is, because there were tables set up in front of the band. So if we can have the video.
It's about just keeping the community safe and unsick and keeping the hospitals empty like we're supposed to do.
COVID-19 cases continue to spread from a concert on Thursday, October 14th at the Blue Grotto nightclub in downtown Kamloops. Owner Puppy Johnston says out of the 24 people who have been tested, 18 have tested positive for the virus.
50 guests, probably about 6 staff and maybe 12 band members. That was all that was in the room that night for no more than a 3-hour event. So to me, yeah, that's a significant number of cases in that short amount of time.
Johnston has spent more than $7,000 COVID-proofing his bar by installing plexiglass walls to separate tables. Even with that, he says it's impossible to keep the virus out.
We knew we weren't going to come out of this unscathed. The amount that's coming out of this one event is shocking and eye-opening. And I think everybody, this is why I came out with it right away.
In an email to CFJC News, Interior Health says it cannot disclose the vaccination status of those who were tested. But according to Johnston, everyone who entered the building scanned their vaccine cards. Although cases from the October 14th event continue to rise, Interior Health has not told him to temporarily shut down. Johnston says the Blue Grotto has been professionally cleaned and sanitized, but as an added measure, he will close the doors for a few days.
I think it's actually the best thing a business owner can do is jump on this, be proactive, take the financial hit, make sure the community is safe first, and then, we put hand sanitizer out on every table.
Johnston says it might be an indication that the club and event industry is not ready to be at full capacity.
Let this be a warning to people that even under the very, very strictest guidelines that we've been running here at the Blue Grotto, that this can happen anywhere. And it's not cool to not report cases.
Amandalina Laterio, CFJC News.
Okay, so maybe I can bring on our professors. Just to give you, well, first off, let me thank CFJC News for the clip. To provide a little bit more background, I spent about an hour to 2 hours speaking with the owner of the club. So in total, there were 29 people that ended up getting infected as a result of the live event on October 24th. I did email the Interior Health Authority to ask for outbreak information, and I just received a response today from Dr. Fenton, who's the head of public health for Interior Health, who basically said that there was no outbreak. There was no outbreak notification. It wasn't classified as an outbreak. So I've asked for clarification what constitutes an outbreak, given that there were 29 cases. Now, just a little bit adding to difficulty, some of the people that attended, sure enough, went to a bar beforehand. Actually, they went to 3 bars beforehand, and they also went to bars after. So where exactly the outbreak started becomes a little bit difficult, but presumably with whole genome sequencing, we should have been able to map this out. Other things to add, in terms of the virus, just to clarify, it was the Delta, and at the time, Alberta was in a massive outbreak because the premier of that province had opened up the province in the summer. They called it the best summer ever, so all measures were taken away. So they had a huge Delta wave, and particularly in the rural parts of Alberta, where unfortunately our band had been. 2 of the 3 bands had toured. The Delta variant, if we remember, is not as contagious as Omicron, but certainly in terms of severity, for us in BC, we've seen a lot of deaths associated with Delta, particularly in the unimmunized. So talking about the virus, then talking about the environment. So the bar basically lives in a building that is quite old. It was a previous Woolworth shop, basically. So quite old. It has 2 HVAC system on the roof, but HVAC I use loosely because there's no filter. All it does is push air, clean air, but there's no filtering. And then the surface area is quite big, though I presume that they close parts of it when they're holding concerts. So they'll probably close the front, and most people will be hanging around in the booths and closer to the stage. Surface area is about 3,500 square feet. What else can I tell you? Of the people that we know that were infected, one of the band's 4 members got infected. The 3rd band which also had toured in Alberta. One person got infected and their girlfriend was infected. We also know that some of the staff, waitress, bartender, and sound technician were unfortunately infected as well. The restaurant owner, despite what you saw in terms of his beard and his mask fit, was not infected. And I think that's it. So any questions before we go and talk about all the various mitigation that needs to change when we take COVID as spread through the air? Any question about the bar or the event? Professor Jimenez or Professor Prather? No? Okay. So we thought we'd start, you saw the prominence of the hand sanitizer, and also after the outbreak, we'll call it an outbreak, the owner paid for what we would call in healthcare a thermal clean or disinfection. So once we accept that the virus is spread through aerosol, droplets play less of an important role. And decontaminating surface is particularly important if we have a lot of people sneezing, coughing, droplets being created, and then we have to decontaminate surfaces. But in setting of businesses, it's been shown time and again that there hasn't been cases linked to contact, be it fomite, indirect, so either touching a surface or touching directly, shaking hands or things like that. So there hasn't been any, as far as I know, known cases of surface contamination. And so all the amount of energy, time, and money that's being placed on what some people now call hygiene theater would be best shifted to addressing filtration, ventilation, and whatnot. In addition to that, what has been made clear is that in some of the hand sanitizer, and particularly in disinfectant product, you end up with components that are actually harmful to health, be it benzenes, be it quaternary ammonium, be it bleach. And so these are not to be used lightly, and certainly not to be abused when, in fact, droplets and surfaces are not the main mode of transmission. So that's how I would start by talking about the business of sanitizing, hand sanitizing, and disinfectant. Not to say that it's not worth cleaning your hands, but soap and water really works just as well. So now we're left with maybe moving on, that this was a punk rock band or three bands. So how do we view Aerosol Generation from breathing, talking, and shouting or maybe singing loudly? So I'll tag Professor Jimenez to lead us through that.
So that is an excellent question, and we know now that when we just breathe, some aerosols come out, but it's much less than when we talk. You would say it's a factor of 10 less. And when we shout or when we sing punk rock or when we sing in a choir or something, it may be 50 times more aerosols and 50 times more virus than just when we breathe. So that's a very dangerous situation. And it is very clear, and I don't think anyone disputes, that vocalization and singing and shouting is very associated with transmission. For example, there is a ton of outbreaks in choirs. We wrote a paper, but there is literally dozens. To my knowledge, there is no cases in libraries, no outbreaks in libraries or in movie theaters where people are sedentary and are just breathing, because really it's a huge effect. And also in bars where the music is very loud, and then if you want to talk to someone, you have to yell, so that really favors transmission.
Okay, all right. Actually, maybe while we're on that topic, what about aerosol generation in children versus adult? Is there any evidence of less aerosol generation in children?
There are some papers, and children also generate aerosols, but it seems that they generate less. But they can still, I mean, children still transmit the disease, and we think in the same way, but it seems that they may generate less aerosols than adults.
And children
Okay.
like to yell. I mean, when they're yelling and screaming, then they're going to generate aerosols. It's impossible to avoid. So,
okay, that's a good one. All right. Now, what about the bar owner spent $7,000 on plexiglass? What do you think about that, Dr. Jimenez?
I mean, unfortunately, it's sad, but it is a case study on wasted effort, wasted money, and a false sense of security. He seemed to be an owner that was trying to do the right thing, to hold an event that was safe. Nothing he did was useful, and he didn't do what would have been useful. He spent $7,000 in plexiglass, probably 1,000 or more disinfecting, doing a deep disinfection, then all that hydrogel and whatever. And none of that really does much. He could have spent a fraction of the $7,000 in some of these coarse Rosenthal boxes, and that would have been made an enormous difference. Or some CO2 meters to help him ventilate the place. So it doesn't need to be any more costly, but it's just this. I mean, as Professor Prather said, once you understand how to do it, it's not any more costly or more difficult than what we are doing. It's just different, and it works. The difference is it works, and this stuff he was doing doesn't work.
Just to spend a little bit more time, because some people still don't know about CO2 monitor. What do they do exactly?
So we humans exhale CO2. So outdoors, there is about 400 parts per million, meaning out of every million of molecules in the air, 400 at CO2, and that goes up slowly, and that causes climate change. But then we humans exhale 40,000 parts per million. The food that we eat, we burn it, our metabolism burns it, and then we exhale CO2 as a waste product. So if you put a person in a box, which is basically a room, then the air gets somewhat trapped and the CO2 accumulates, right? So then we get infected by inhaling the exhaled air of others. So CO2 tells you, is there a lot of exhaled air or a little or none, which is the place well ventilated or poorly ventilated? And there are devices like this is one of them, they're portable, they cost $100, $200. They measure every minute and they work really well. So this tells you, is a place poorly ventilated? Do you have to open the windows a little more? Do you happen to have to open an extractor? So they work really well for that purpose. They do not, the one limitation is if you put filters, CO2 is not filtered. So then the CO2 may give you a number, but really the risk is lower. So that's the one thing to remember.
Okay. And just on that vein, so limiting capacity also limit the risk of somebody emitting more CO2 and also more indirectly more virus particles as well.
Yeah, I mean, if instead of having 100 people, you have 50 people, you have half the chance that one of them is infected, and especially many infected people are not very infectious. Then there is a minority that exhale a lot of virus. So you have a lower chance that one of those people is very infectious that's present. And then if there is one that's present, they're going to infect less people, right? You have a maximum of 50 instead of a maximum of 100 to infect. So.
Okay. And also limiting times then from the same logic?
Exactly, because basically you're breathing in the air. So if you are sharing the room with someone who's exhaling virus, imagine someone who's exhaling smoke. If you spend 5 minutes with them, you'll inhale some smoke. If you spend 5 hours with them, you'll inhale so much more. So you have a much higher chance of infection.
Okay, and just to finish that thought, even if the person who's infected leaves, people coming into the bar after the fact can still get infected.
Yes,
if there's poor ventilation.
Yes, especially if there's poor ventilation, because the virus can linger in the air. Now, I would say it can happen if they come in immediately afterwards or 30 minutes later, an hour later. If they come back, a day later, 2 days later, then that virus is gone. But if they come very close, that said, a lot of the outbreaks that we have is when people were in the same room at the same time, because that's what facilitates breathing a lot of air. But the other, what you said, is also possible.
Okay. All right. So now moving on to ventilation, Dr. Prather, what could the bar owner have spent on?
I mean, the one thing that I heard you mention was that basically they didn't have the air coming in from outside was not filtered, right? So you'd want to have, I mean, that's one spot to start, just because a lot of times, I don't know where you are, but where we are, we have a lot of wildfire smoke and air pollution outside. And if you just bring in, quote, fresh air, you're bringing a lot of air pollution. So the beauty of, so from a ventilation perspective, sometimes you're limited where you live. That if you just open the windows, you're bringing in, smoke, and that's not good to breathe either. So that's where, I've really been sort of making it clear, because it's sort of left out of a lot of the conversations, is the filtration. So I think Dr. Jimenez mentioned buying these Corsi Rosenthal boxes. I don't know. I think there's a picture. I don't know if you wanted to show she said she could show the picture on the screen. I noticed in the chat. I don't know if she's ready. I'm catching her up. If I'm catching her off guard. I'll keep talking. But basically, buying these filtration devices, buying ways to measure your ventilation, and the CO2 sensor is a good thing to have, because you can tell, again, CO2 just starts to really go up the more people that are in a room if your ventilation's poor. And so there's the box. I will add, so that's, that's 4 filters, just standard filters, and then a hurricane box fan. And they're amazing at filtering the virus. I always say you'd rather have the virus end up in that box, filtered by that box, than your lungs. The one thing that I would add is that it's better to have, it's just little, it seems little, but it's important. It's better to have, if you can, the fan pointing up. So it'd be on the other end. So, and people build them all different ways, but having it pointing up mixes the room air and makes the ventilation better too. So it goes hand in hand. And so, again, depending on, you said it was, I think, 3,500 square feet. So in that size space, you would want these sort of distributed around, where the people are. If you wanted, if you knew your band was, healthy and not infected, and you're worried about them catching it from the crowd, one of the things I've advised people to do in Broadway is to put a line of these sort of in between the audience and the singers, right? So that it can just filter, so it doesn't pass between. But kind of dispersing them through a room is a good idea. The thing with ventilation is it takes quite a while to get the whole room ventilated. Whereas if you have these boxes, they can pull the virus out of the air right away, as long as they're kind of close to the people who are emitting it. So putting them in different parts of a room is a really good idea. The other thing you can do, if you have multiple ones, is run them on lower speed so they're quieter, because sometimes people will complain, but these actually are quieter than most HEPA filters. And as I say, I mentioned before, they cost a lot less. So.
Okay. Now, what about, so you place a bunch of these strategically throughout the bar, and then what about still leaving window open, front door open?
I think it's still a good idea, just to have everything on your side, right? So it's the layers of protection that we talk about. They're each doing some amount of work, right? And so the cumulative effect is going to be more positive. The more things you can do to, get that clean air in there.
Okay. And then just going back to the HVAC, I know not all HVAC can take newer filters, but the push, my understanding, is that people should up their filter to a MERV 13. Is that correct?
Yeah, I mean, that's what has been sort of the going number. I don't know, it's sort of changed. Some people are saying that if you run, like, some of the systems you can't run with a 13, it just doesn't fit as well, and the pressure drops too high. So some people are dropping it back to like a MERV 11, just because you can pump more air through faster. So again, the 13 is kind of suggested, but sometimes the problem with it is if you get too high a pressure drop or it doesn't fit in your system well, then you have leaks. And so you don't want that. And so, it's MERV 13 though is kind of the standard. I don't know, Jose, have you also seen people sort of lowering the number a little bit, because you can pump more, like these are, 11. I've seen people use equivalents.
Yeah, no, I think I agree with what you said, that sometimes, you want the best, what you want is the best product of a good filter and a lot of air. So sometimes if
Mm.
you try to put a really good filter, but you choke the fan, like if you were to put a HEPA filter in your furnace, you would choke the system. It will move very little air. The air that will go through will be perfectly filtered, but overall you are in a worse situation, right? So yeah, so I agree with what Professor Prather said. Yeah.
So a question of resistance. How much can your HVAC take? Okay. And now it also begs the question, a lot of places have ceiling fans. And I'm always concerned that we don't know who's infected. And are we moving the air from infected person to non-infected? How do you deal with that?
That is a question that comes up. There was one example where air was being pushed around by an air conditioner in a restaurant, famous incident, and it got trapped. The air got trapped at one end of the restaurant. So that's where the CO2 filter would tell you that that air wasn't circulating properly. It was kind of all hanging out in one part, and all those people got infected, and they weren't within 6 feet of each other. And so I think that, you know, that's where the filtration is so powerful. It mixes the air, but it's pushing filtered air. There's no virus in that air, right? And it's doing it fast. And so it actually processes the air fast and a lot of air. And so it removes it. So the idea of having this fan, going is beneficial overall. But filtering it is ideal if you can.
Okay. And then maybe before we move on to mask, maybe talking about washroom, because in BC now, and I'm presuming it's the same in the States, we're using sewage data to monitor virus. So what happens to public washrooms?
So I think that a lot it's anecdotal. We don't have that. We don't have I have not found a study that really has gone in to prove that it transfers in bathrooms. What I think is important, and is a great question, is to think about these smaller spaces, and bathrooms are notoriously poorly ventilated. And so, and then when you go in the bathroom, in a public bathroom, and there's no one around, what do people do? They take their mask off to take a little break. But there doesn't have to be people there. The virus can hover in the air for hours. And so I think a lot of people, like break rooms, this has happened in hospitals, even with, doctors. The doctors feel like they know the other doctors are safe. They're just in this little break room. They take off their mask. And so that's the danger in a public setting, is that, the virus. Elevators is another one. It's probably not the elevator button that's been accused numerous times. It's probably the air that was shared. So small confined spaces with poor ventilation in a public place, they're all risky. And so, and as far as the sewage being, we don't know as much. It hasn't really been talked about as much. SARS-1, as you know, was linked with sewage. This virus, it hasn't been shown, it's basically a lot of the studies have not been able to show that it's still infected, it remains infectious that long. But I still think people should be cautious. When you flush the toilet, it's just a great way to aerosolize virus. But again, I don't think that route has been really pointed to as a major one. I think there's still things being learned about that.
Okay, but still precautionary principle, ventilation there, keep your mask on, and if there's a lid, close the lid before you flush.
Exactly. Yep.
Okay, so it brings us to mask, Dr. Prather. What can you tell us?
Wear masks, they work. I can't believe this has become political. And I hesitate to say it sometimes because people get angry. People are tired of wearing masks. I'm tired of wearing a mask, but I'm also enjoying the fact that I haven't had a cold or a flu in over 2 years, or COVID. And I wear a good mask, a simple mask. I think I've got one here, but basically, wearing a good mask that fits, that doesn't have any gaps, is really important. And yes, they do exist for kids. And my experience is that kids get used to them. They're not, being abused to wear these masks. So you're protecting them, right? And so it's shocking to me. It's sad to me how this has become such a polarized topic, because again, we're all sick of it. But you wear the mask, as in terms of getting rid of, infection control, what's the first thing you do? You block it at the source, right? So that was the original intent of the masks, was that if someone's sick and doesn't know it, and at the time, most people didn't, there wasn't very good testing and whatever, you wore the mask to protect others. That's why people do it in Asian countries. It's just to be polite and thoughtful. But you do get a benefit because it filters in both directions. So you're also better protected. And so that's your first line of defense. It's your only, you talk about indoors, truly, when you're really close to someone, and as you might be in a bar when you can't hear and you lean over to hear them, right? You'll be really close. And in that case, ventilation and filtration aren't really going to help you enough, right? The only thing that would protect you is a mask. But if you're in a bar, you're drinking and eating. So that's where a lot of the spread, unfortunately, happens. And yelling. You're yelling, singing, no mask. It's a bad combination.
Yeah. And then plus you have plexiglass here in BC. So if the person in front of you is infected, the air is not going to circulate and dilute.
Not fast enough. And so that's where limiting the time. Like, again, we don't know how much time. It just keeps changing. We have this, CDC has this 15-minute rule that they made up from who knows where, cumulative rule, over 24 hours. It's not changed, even though the virus has become more infectious. And so this 15-minute rule, 6 feet, that's the only way you contact trace and count those people, right? And that's just, it. So you really do, I would just say, we don't know. There's some, again, closed caption TV videos where people have watched people that they know caught it from each other and they watch them just pass. I don't know if you've seen those stories.
No.
Is there enough? If you have an infected person talking and you get a breath of like cigarette smoke, is that enough? I don't think we know. But if I don't have my mask on outside and I pass a group of people that are talking and standing around, I just automatically now hold my breath. And a lot of my friends do too. And if I smell cigarette smoke, I'm thinking, oh no, I hope COVID wasn't in that same air. But anyway, so yeah.
Okay. But in terms of masks, KF94, KN95, N95, which one?
I wear N90, I have a couple of favorite N95 masks, types that are very comfortable, incredibly breathable. This concept of, it's terrible to wear a mask, or, CDC director complaint, like kind of makes it seem like these are not the cup, that hard cup that cuts into your face is terrible, right? But they've come so far. 3M for sure has come really far. So again, there's a couple of models that work really well. And then KN95s are good. The problem with them is that there's a lot of fakes that don't work as well. And they're, when people try to buy it, it's hard to know. And so that's why we kind of are a little more cautious unless you know, and they have been tested. So I wear one that I know has been tested and works really well. And it's really comfortable. You honestly, at this point, almost forget you have it on. And then where the KF94 comes in, that's a Korean type. And there are models that work really well, probably the best, I would say, well, in terms of respirators, or masks, they work for kids. They're small sizes. There's different sizes. And all the kids that I know that, don't mind wearing a mask and that wear it properly, the KF94 seems to fit their face better.
Okay. Anything to add, Dr. Jimenez?
No, I think that was, I'm in agreement with all of that. I guess something to mention at the high end, so for people who work in a hospital or something like that, or in a risky situation, would be the elastomeric N95s, which is basically an N95 filter with a piece of plastic and then some silicone or something that seals better to your face. You look a little like Darth Vader, but I wear one of those, and I'm too old to worry about how I look. So for people who are more at risk or who want to protect themselves more or who work in risky situations, I would recommend to consider those.
Okay. And particularly better for the environment as well. Yeah. Okay. Yeah. And 40 hours is what Aaron Collins, the mask nerd, says that you can use your mask or respirator for. Does that fit with what you use? Or until it's soiled, or
it's the strap. What happens is the strap breaks before you lose your filtration. So
Okay.
especially the ones that are really tight fitting. That's, I've also heard him say that. So that ends up happening. I think he estimated at about 40 hours, but basically the filtration will last longer than the strap. Generally.
Okay. All right. So maybe we'll I'll take us to the end with the last couple of slides. So Carrie, if we could. All right. So really, if we can go back one slide, please. Okay. So at the individual level, these are our layers of protection. And really what Omicron calls us to do is to bolster every single layer. So not only get quote unquote fully vaccinated, but get your third dose. Because for Omicron, fully vaccinated is 3 dose. Wear the best mask, and in fact, we're suggesting wear a respirator, an N95, and avoid indoors with people outside your bubble, particularly if you don't know about the ventilation, if it's crowded, and you're not sure how well people are wearing their masks. So outdoors always better. And then the other 2 layers of the Swiss cheese. Physical distancing does work even with aerosol, and then again avoiding large gatherings, as we've said. So next slide. This slide is really to show what the government needs to do. First of all, the ASHRAE came out in April 2020 with their epidemic task force, suggesting there was enough evidence, even in April 2020, to suggest that the virus was spread through aerosol, and that the HVAC and air filtration would play a key role in improving the air quality indoors and preventing transmission. So we need here in BC and in Canada and elsewhere to endorse the ASHRAE pandemic standards. We need to start monitoring air quality indoors, and that we spoke about was through the CO2 monitor. And then finally, SARS-CoV-2 needs to be recognized as a hazardous bioaerosol. We know that indoor, spending more time indoor in a poorly ventilated setting puts you at risk, and there are some jobs that are particularly risky right now. And so we need to recognize SARS-CoV-2 as a biohazard. And next slide, please. So there's a lot to learn, and the Association of Professional Engineers and Geoscientists of Alberta is hosting a free webinar on March 1st, looking at the ASHRAE core recommendation for mitigating aerosol infection indoors. And in addition, on March 9th, I'm blanking on the acronym, but it's Work Safe Without Borders, or Workers' Health Without Borders, is putting on a ventilation and risk assessment for COVID-19 prevention. And that is again free, and it's on March 9th. And then last slide. Yeah. Oh, and maybe we should touch on this slide. Dr. Prather, you want to do the honors?
Yeah, one of my favorite things of this pandemic has been just teaching people what the street lamp effect is, which is shown here very well. That if you only look under the street lamp, you're always that's the only place you're going to find your keys. And in this case, it's really truthful for how we've done our contact tracing, which I think is pretty severely flawed. We only look at people that have been within 2 meters and exposed for longer than 15 minutes. We don't know how many other people could go. I mean, we kind of do. We do know that entire rooms of a choir have gotten it, right? And they weren't within 6 feet. But by true contact tracing, we only look at, we use these to restrict us. And it kind of came about arbitrarily out of the blue. And remember that the virus has become more and more infectious, which means the time should be going down, and the distance maybe should be getting further as something becomes more infectious, but it hasn't been changed, and that's problematic. So we hear a lot of people say, "Oh, it always happens within 6 feet." if that's the only way you look, or the only people you look for, that's always going to be your answer. So I have been working actually with people who are doing the tracing with the phone, the alert, and have convinced them to just look at the bigger distances and see if you pick up more cases. And so people are thinking about this now.
Okay, thank you. So I don't know if there are any questions from the media or the Twitter sphere. See if, oh, here we go. What is it going to take, in your opinion, to get mainstream acceptance of airborne spread to happen? Any guess?
That's a tough one. I mean, Jose and I are I think I don't want to speak for him, but I think we're as perplexed as any. I mean, like, how many more deaths do we have to have? How many more healthcare workers do we have to have get infected? I mean, it's just shocking to me that there's even a debate. And it's interesting because Jose and I talk about this all the time. I think we both talk about it in our sleep. I don't know, but we think about it and all the time, like it never goes away. And but it's weird because sometimes I wake up every day and tweet COVID is airborne. I'm going to tweet it until we're through this, right? And you get two reactions. You get why does she keep saying that? Of course we know that. That was solved 2 years ago. Why does she keep repeating herself? You get that response, and then you get I'd say more people in the Twitter world probably know it than anywhere because there's so many of us hammering it home every day. But I don't know. I still feel that, I look around, you go into I went into a business yesterday, and I rarely do it. There wasn't a mask in sight, but there was a big bottle of hand sanitizer right there. Right. And so that just tells you see far more hand sanitizer than you do masks. And what does that say about what the public thinks? And the last thing I want to quickly add is that I really hope, I've been pushing really hard, and we didn't mention it, but I have to bring up the healthcare workers, the essential workers, not just the people treating the COVID patients. They find COVID in the non-COVID, more COVID in the non-COVID wards. Right. And I just feel, I can't believe that I feel for the healthcare workers. I have all along. That's part of the reason I've been fighting really, really hard. I just can't believe we put them in that position. We give them N95s for aerosol generating medical procedures. But it's been shown during this pandemic, you generate less aerosols through most of those procedures than someone talking. Yet we don't give it to the healthcare workers for people talking. It just makes me crazy. Anyway, sorry. Go ahead.
No, but just to add to that, the timing of people presenting needing to be intubated is further in the illness, and they're more infectious at the beginning. Yeah. And as well, when we intubate patients, there are times that we know not to assist if we can, not to bag, what we call bag, because we don't want to generate aerosol. So we try to oxygenate people the best we can before we start the procedure to intubate. But anyhow, yeah. So Professor Jimenez, I'd be curious about what you have to add, because I know you've talked about this as well.
Yeah, I know. I mean, like Professor Prather, I wonder about this a lot, but I think, with time and with talking to a lot of people, I think the fact that there has been so much resistance is not a coincidence. We are against a couple of very powerful forces. One is there was an error in the field of infectious diseases and medicine that dates back a century, and which made at the beginning of the pandemic, organizations like WHO and other public health organizations make a huge error. WHO said that to say that the virus was airborne was misinformation. Now, not a year later or whatever, we know it's not misinformation, it's the main mode of transmission and probably the only important mode of transmission. So they've made an error, which is one of the biggest errors in the history of public health. And they want to save face. I have an international government official said, we have to find a way to save face. It's like, well, I think there is resistance from that angle, but it's not the only thing. I think also at the beginning of the pandemic, when we were all scared, listening and willing to do whatever, they told us it's the surfaces, it's the droplets, it's the distance, whatever, and we all learned and we all did that. And then the governments are finding it very convenient because if it's the droplets and the surfaces, if you get infected, it's your fault. You didn't wash your hands enough, whatever. It's all responsibility on the individual. business owners still can waste money on plexiglass and whatever, but if you get infected, it's your fault. Well, if you get infected because you were breathing the air in a government building, in a school, in a hospital, it is not within your power to clean the air. And that governments find very inconvenient. And we've been told by some governments that they're waiting for COVID, for this ventilation thing to go away because they don't want to spend money on it, privately.
Yeah, so I want to get to other questions, but just to say, in terms of saving face, you would have thought that Omicron would have been the perfect subvariant to save face, and yet it didn't work.
It recruited a few more people, is what I will say. I did see some cross the line, not many, not enough, but yeah, it did.
Okay.
I message everybody I know at WHO, whatever. This is your chance.
This is your chance to save face. Yeah.
Yeah.
Okay.
They do say Airborne now, though. They do. December 23rd, right? They see quietly. It appeared. Airborne is on the WHO site now.
Yeah, it's still not clear language. Let's put it that way. And that is partly, using my coaching training. That's why the expression is name it to tame it. And the last part is to claim it. And really, that's until you're able to even say it's airborne clearly, you're not there yet. You got to name it. You got to name it. Yeah.
I mean, one thing I just want to mention real quick, you got me thinking, because you played a big role in SARS-1. Yeah, right. And one of the big lessons, you did it right. You treated it as you implemented the precautionary principle. Other places didn't. Your hospital did well, right? Where has the precautionary principle gone? If there's any chance that it's airborne, you say it's airborne and you protect against it. Do you understand?
Yeah, and it's not a foreign concept for physicians. When we see people with sepsis, so they've got a severe infection and we don't know what the source is, we try to find the source. But if we don't know, we actually say it, we bring out the big guns in antibiotics. You're not very specific. You take the big guns because you want to cover all the chances of different bacteria being the source of the infection. And it's only after the blood culture and the other cultures come back that you narrow your armamentarium in terms of antibiotics. And this is completely the opposite. We've anchored, and now to try to change from anchoring this was droplet to no, we're wrong, has become so difficult to pivot. And also, and I tweet about that, you need also psychological safety. So the best leaders are the leader that accept I was wrong. I got this one wrong. And somehow we're not there. So let me see if there's any other questions from
there it is. Yeah.
How often do the filters for Corsi-Rosenthal box need to be replaced?
The number that I've seen Rosenthal give is 6 months. So they probably can go longer than that. He actually I think he or somebody tested if there was because you can get so much, in theory, you can get so much stuff in the filter that it could be slowing down the flow, but they don't even really see a lower flow even at 6 months, but it's just a good idea. They start to look black. I don't know if you've seen the ones that have been run even for a month. You look at them indoors and you realize I could have been breathing that, right? That's one thing I also will add. I hope these become part of our everyday lives. I hope that filtration is just now a standard. Like, we filter our water, why don't we filter our air? And so I think these are magical. And I think you could, I'm thinking of kind of creative ways, make them into coffee tables and, just ways that just become part of your life would be awesome, because it will help us with all respiratory viruses in future.
There was a question from one of our teammate whose kids are in a classroom where instead of all facing forward, they're facing each other. And I don't know why that is, but can you put them on the desk, the kid's desk? Is there any way?
I've seen these little ones. There's people making little ones that are like desk. You could put them on a desk, and people, that's what they are using them for, is their office desks. You can make smaller ones. They filter less air, but they will filter that immediate air. The other thing that's been done, it was people in Germany, Max Planck Institute. They put massive, just hoods, suction hoods coming down over classrooms, and they just suck it out of the like with huge amount of filtration. And they've been putting these in classrooms. And the other thing they're starting to do, we don't see it as much, is the UV, upper room UV, to kill it. The problem I have it's a great thing. It's really good, especially if you're in a place where people are eating and can't wear a mask, or a bar and drinking. The downside, I don't know if that's the right word, but they work really well for killing the virus. It works really well. That UV, not a UV in a filtration device. It doesn't work because the air goes by too fast. But up in the upper air, they call upper room UV, it does work really well. But it will not remove air pollution particles. It won't it won't remove allergens and dander and all the other things that you really don't want to be breathing indoors.
Okay. Okay. Anything to add, Professor Jimenez?
I think I'm fully in agreement. Nothing to add.
Yeah, I'll just add the point. One of our founders says, it's not, if you think about cholera, it's not because you're vaccinated against cholera that you're going to be drinking contaminated water. And the same thing goes with COVID. It's not because you're vaccinated against COVID that you should be breathing contaminated air. And I think people forget that. They want one single magic bullet, and there isn't. Okay, we'll take the next question. Is it possible to prevent the transmission of COVID-19 between household members? For example, with young children who can't be isolated, or is infection inevitable?
It's not inevitable. And in fact, the attack rate, even people who don't know a household member is infected, is still, I don't know, for Omicron, maybe 30%. So most of the time, actually, people who share a house and are not doing a lot of stuff don't get infected. Now, if you wear N95 masks, for example, with the kids, and as Professor Prather was saying, if you have a Corsi Rosenthal box or a few of those, I think, and I had the same experience, I had given these tips to different people and nobody got infected. It's anecdotal information, but I think it's definitely feasible if you understand how the virus is transmitted.
I think there's some good, and maybe we'll put them on the blog. There's some good resources by Clean Air Crew in terms of if somebody in the house is infected, and how to set up the room for them to make sure that the air doesn't get mixed with the rest of the household, in addition to wearing masks and everything else and filtering. So, yeah. So it's not, contrary to our public health officers here, getting Omicron is not inevitable.
Nope.
All right, next question. Okay, so this is from Trinity Bissett. My daughter's grade 6-7 split are allowed to run around in gym for 40 minutes without masks, no ventilation. She said about 5 do that. What do you think? I presume it's 5 kids that do that. And there are about 30 in the gym at the time. So I'm not quite clear. So kids running in a gym.
5 without masks out of the 30, I think, is the question.
Okay. So what do you guys think? Actually, why don't we start with Professor Jimenez, because I saw you posting CO2 from your child's basketball competitions or practice.
Yeah, I don't know exactly what they're saying, but if they're saying the ones who are running are the ones who remove the mask, it's not a great idea. I was reminded when we were seeing the video about the bar, the owner was taking off the mask to talk. Precisely when he's generating the most aerosols, he's taking off the mask. And a lot of the politicians do this. And the same thing, if you have people in the gym, the ones that should wear the mask are the ones exercising because they're producing many more aerosols. It's more uncomfortable, but yeah. So that's how I would say it. Yeah.
Anything to add, Professor Prather?
I just would add that, when you're exercising, you're both producing more but also when you're exerting yourself, you're breathing more deeply. And so you're going to, you're inhaling more frequently.
Yep.
So you're inhaling more air. So the chance of being infected when you're exercising becomes higher.
Okay. Yeah. And I'd probably add, just to gloat a little bit, that the Canadian hockey team, women hockey team, won a gold medal at the Olympics wearing N95. So if they can do it, you would think that other people in the gym or exercising could be wearing N95.
And people come to Colorado, all the Olympians, because it's high and there is less air, and then you train better. So, if you're training yourself in the gym, if you make yourself a little harder to breathe, then you're training better,
Right. Absolutely. Okay. No more questions. So let me just make sure that we've debunked all of the myths. There's still a lot of resistance here in BC of allowing HEPA filters into classrooms. And I think a lot of it stems from public health thinking that the virus spreads through droplets, but really there's no interference between having a HEPA filter in your classroom with the HVAC filtration of the whole building, is there?
No,
Okay.
it just adds. It's additive positive.
Mm-hmm.
So, and I will add, there's a paper that just came out yesterday or the day before showing that HEPA filtration will actually, or Corsi Rosenthal filtration, will actually reduce the amount of deposition you get on surfaces too. It actually can, stop the amount on surfaces if, you have something that is infectious on surfaces.
I mean, if I may add that, there is resistance sometimes because of the droplet dogma. There is also resistance because governments don't want to pay for them because they cost money, especially the commercial HEPA filters. And it was actually, there was a regional government in Spain where someone we know confidentially told us they had been charged with writing a document explaining why HEPA filters didn't work. This was someone who worked in the administration. And they told us confidentially, and they said, the real reason is that if we say that they work, the government says they work, then we have to pay for them and we don't have money. But this was, and this has been happening all over,
But the reality, there were so many parents willing to donate HEPA filters. And the point you made, Dr. Prather, the Corsi Rosenthal box, maybe here they cost $200 in Canada, but really they're easy to make. They're a good science project.
Great science.
And the cost is so minimal, and yet it's engaging. And really, I don't buy the cost factor, because one of our epidemiologists here showed that the cost of being hospitalized on the general ward with COVID, if I don't get it wrong, is $23,000. Now, I might get it wrong. Maybe it's in the ICU, but you can get a lot of things for 23, avoiding, hospitalization and ICU admission. Plus, we know that there's going to be a lot of chronic disability via long COVID, and avoiding any long COVID, long-term disability, particularly in children, but even young individuals, and myself, I would include, I don't want long COVID. That's the thing that scares me the most.
Absolutely.
Right? It's, again, the precautionary principle, a new disease that we don't understand. We know there's post-viral syndrome associated with other viruses, and it's clear now that the same goes with COVID. And yet we disregard the long-term consequences.
And also, if you think about it, I saw something, I thought it was in Canada, they placed an order for like 5,000 liters of hand sanitizer or something. That's a lot. You could build a lot of Corsi Rosenthal boxes for that, and they last a long time.
Yeah.
So it's cheaper, and it's cheaper than buying, and pouring through the hand sanitizer.
Yeah, and it's effective, which is most important.
The right thing. Yeah, I forgot about that part. Yeah.
Oh, here's the link. Oh, thank you, Carrie.
Yay.
So Clean Air
That's an
Crew.
awesome site.
Yeah, Yeah, and Jim Rosenthal has done a great job as well, being an ambassador. Um, any other things we haven't covered? No?
Covered it all, I think.
So how many of these sessions have you done in the last year?
I think. I don't know. How many have you done? It's like I lose track. Sometimes I do several in a day.
Yeah.
It's coming down. I've been having to go back to my day job. So I don't know. In the last year, it's gotten less. First year was really crazy. First year was hundreds. This year is probably, I don't know. It's hard to say, maybe 100, something like that in a year. Something like every few days. I do a couple times a week. I go on. Not this long. Like I do certain radio stations. I'm the expert that goes on. We keep saying, okay, we're going to stop having ask an expert because the pandemic's over. And then they bring me back again. And I told them this time, this is like Groundhog Day.
Yeah.
So, but yeah.
Yeah. And
Jose,
you, Professor Jimenez?
Yeah.
I've listened to several.
The same. I've done a bunch. I've done a lot in the Spanish-speaking world. This morning, I was doing a 2-hour session with Chile, Colombia, Venezuela, and whatever the ministries of health. And yeah, I mean, you have to try to get the word out. I mean, I guess my last thought is that people like Professor Prather and my help, we want to help. We need to work with doctors. We don't think we are smarter than medical doctors. We need the doctors, but we need to work together.
Yeah.
Once the virus leaves the body and it floats in the air, that's what we've spent our careers understanding. And really, there is a huge amount of knowledge that we and thousands of other colleagues are very happy to help with. And that's what's frustrating is, we're wasting a lot of money, like in that case of Study the Bar, and we are not tapping into expertise that knows what to do and that is available in BC and in everywhere else.
Yeah, could not agree more. What about you, Dr. Prather?
Yeah, I mean, I just think the last message is, and I said it before and I'll say it again, is that this is a really fixable problem. If people just cleaned the air, if you just filtered the air, ventilated, did the right things to knock back the spread, to drop that spread down, we wouldn't be in an ongoing pandemic. It would have ended. And places that did embrace the fact that it's in the air have done much better. And so it's a solvable problem. People keep getting sick. People keep dying. It is, it's caused a lot of us to lose a lot of sleep worrying because, we just keep thinking maybe we're not saying it enough. Maybe we're not saying it correctly. Like we're trying really hard, but we're tired. Everybody's tired. And it's now people are really tired and they're, I will say, getting a little frustrated sometimes with us, the messengers, right? Because we're viewed as putting on, they call it restrictions. We would prefer to call it protection. They're protection for you. We're not for your kids, for your family. It's to help you. It's so how people can become angry at us, when we're trying to help. It's not making sense, but it kind of does in the sense that everybody's just really tired and they don't want to hear it anymore. And neither do I, but we're still going.
Yeah, just to go back to the point, it's about collaborating. And researching this topic, back in August of 2020, the chief scientific advisor for the government of Canada, Dr. Mona Nimur, put together a multidisciplinary science table. And it included, in addition to physicians, epidemiologists, aerosol environmental expert and building engineers. And their report came out in September of 2020. And really, when you read through it, it's spot on. It's everything we said today. And when she was interviewed, all the people around the table, the scientists, particularly the engineer and the aerosol scientists, said, we don't understand why this is a debate. And this was in August of 2020. And it's interesting because in Canada, we are a federation, and the public health officer in Canada is Dr. Teresa Tame, and she was one of the first to start wearing an N95. Versus here in BC, our public health officer still wears a cloth mask.
And the
So
best one is when they walk up, the public health people walk up to the microphone and take off their mask to speak.
yes.
That one just, wow. Yeah.
Yeah. Well, I want to thank you, and I want to thank you for the advocacy role you are playing. I think it's really important to have this type of collaboration, and also I think we're stronger together, and we all bring different expertise, whether it's lived expertise or different different sciences. And really, when we have a complex problem, we need all the help we can have. And it's certainly been an honor to meet you both, and certainly been an honor to have this time with you together. So on behalf of Protector Province BC and all our listeners, I really want to thank you.
Thank you.
Thank you.
Great. So that's it. That puts an end to our briefing, and I hope you'll join us for the next one. We don't have a set date yet. We're looking at different topics, one of which may be reviewing mortality numbers in BC and why the discrepancy versus the excess mortality. So with that, I leave you. I thank you for being with us today, and encourage you to keep being safe and use all your layers of protection. So thank you. And thank you to the team behind the scene.